Thank you. I do love how the green sign comes up, but that message really says it. A digital cue. Well, welcome back, everybody. We hope you had a good recharge session and were able to take advantage of some good food over there. We know it was sort of walk and talk with food in hand, so appreciate your flexibility and dexterity. We're going to move right into our first afternoon session. And so we're going to move on to something, as I mentioned, just a little bit different than the panel sessions that we've had earlier. I'm thrilled to announce welcome our co-leads for today. We've got Adrienne Cousins, Lara Perzoff, and Joanne Hepplewhite, who will be taking us through a thought exchange on digital health strategies. Adrienne is the Manager of Change Strategy for Digital Health Innovation, part of Michael Tato's team, who we heard from earlier today. Lara Perzoff is the Director of Strategic Support and Issues Management with the Digital Investment, Governance, and Transformation branch of the Ministry of Health. Her primary focus is on amplifying BC's digital health strategy and how it's guiding BC to a digitally enabled, trusted health system for all users. Joanne Hepplewhite is a senior analyst with PHSA's Transformation Leadership Office. She is an engagement specialist who will be running the thought exchange today. Without further ado, over to the three of you.
Tina, thank you. Thanks, everyone. And really want a special thank you to Joanne for helping us with the digital engagement platform that we'll be using today. Some of you may have used Thought Exchange before, and if not, don't you worry, Joanne will walk us through how to use the new tool. As mentioned, my name's Adrienne, and I'm co-leading this activity with my colleague from the Ministry of Health, Lara.
Thanks, Adrienne. The digital health strategy is very much a living document. And as you heard this morning from Mike Cleghorn and from Michael Tato and from Heidi Giesbrecht, the digital health strategy document itself is in the process of being published for a broader audience. And before I continue, I just want to mention that in the audience today is my executive director, Brad Glazer, who is very much a champion of the digital health strategy, and just happy to have him here today too. He's been integral in bringing the document to where it is today. We are looking for your feedback from our sector partners, because it is important to have that as we move forward with this living document to make sure that the strategies that we're trying to put into place are aligned with broader sector priorities. We're making sound investments and putting proper programs into place.
That's right, Lara. And the theme for the conference, our first Digital Health Forum conference in BC, is collaboration in action. And so the first step of collaboration is just listening. And so this is an open dialogue to open the conversation that we'll continue on actually over the weekend. We'll keep the exchange open to hear from you. We will be sharing the information, your thoughts, your ideas, your insights with the respective strategy owners. So each of the 4 strategic objectives that you heard this morning from Michael Tato. And if you missed the morning session, there is a handout in your bags for those of you in the room, and online. It is available on the FeedLoop platform, and we are trying to get the team to pop it in a link as well. But when we go through the exchange, you'll be able to participate whether you have familiarity with the strategy or not. But hopefully you found this morning's overview helpful. So this is a continuation of that conversation.
Right.
Over to you, Joanne.
Great. Hi, everybody. Please take out your phones. We're going to be using an engagement platform called Thought Exchange today. It's an anonymous platform where you can share your thoughts to an open-ended question. Thought Exchange has 3 steps. The first step is share, where you get to share your thoughts. The second step is star, where you get to star the thoughts of others using a 5-star system. And the last step is discover, where you can find out what's most important to you, the participants. So for those of you online, a link to the Thought Exchange will be pasted into the chat. For those of you here, you can wave your phone's camera at the QR code, or you can visit tejoin.com and enter the code 504-480-620. So the first question we're going to ask, I'm going to just give you a little bit of...
Yeah, while you're still maybe pulling out your phones and pulling up the site, Joanne described this earlier. I loved it as a silent but insightful conversation. So yes, everyone's going to be on their phones for the next, 4 exchanges. We're going to do this 4 times, but that's how we're going to get really, I think, a broad depth of information from everyone in here and online. Thanks.
Great, thanks, Adrienne. So according to InfoWay's Canadian Digital Health Survey that they ran in 2022, 80% of Canadians want access to their personal health information electronically. So the first question we're asking today is, how can we collaborate more effectively to ensure a consistent digital front door experience for patient access to health information in BC? So while you're accessing the thought exchange, I'll just let you know that you can enter more than one thought, but we ask that you enter one thought at a time. And once you're done entering your thoughts, you can progress on to the star step and start starring the thoughts of others. Yes, and before you answer the main exchange question, there will be a couple of survey questions for you to answer. One of them is your affiliation, your health organization, and another one is your role. So for those of you in the room, if you missed the QR code, there is a website up at the top left corner here, tejoin.com, and you can jump into the exchange by entering the code on the screen. So you can see here, as people are putting in their thoughts and as people are rating them, the mind map, as I like to call it, moves around. So lots of activity going on.
And that website, for anyone who missed it, was tejoin.com. The code is 504-480-620. I believe we'll leave this particular exchange open for about 6 minutes, but like we mentioned, you can come back and continue to rate the thoughts or add additional thoughts over the weekend. We'll leave it open until Tuesday morning.
Yeah, so we really invite you to jump back in on the weekend and see what thoughts have come in since you were last in the exchange.
So what is collaboration? I see the first one there, Lara, is collaborate across health authorities. Absolutely. What does collaboration mean to you? What does that look like? What kind of behavior is required of us to collaborate? What kind of ways do we have to work and think differently to collaborate?
And if you've rated some thoughts already, feel free to scroll back up and rate some more.
Yes, the one door. How do we get one door, right?
Saying a lot about one digital front door, single portal.
Yeah. So what's going to be required of us, everyone in this room, online, across all our different representative organizations, across all of our different lived experiences and backgrounds, to create that one front door? That's very ambitious, isn't it? I think that as the strategy is mapped out, and as we've heard earlier today, the need is clear. The need for unified patient experience, a connected patient experience is clear. We're now at the point of, how do we make that a reality? We can all agree on what needs to happen. The challenges.
Get there.
Yeah. It's talking to the mic more.
Right.
So we've got about 2 minutes left. If you haven't started rating thoughts or starring thoughts, please start doing that now, and you'll have more of a chance to do that over the weekend as well.
So this particular platform generates a lot of insights that Joanne and her team will help us make sense of. So feel free to add as much information as you can think of.
And a reminder, it is anonymous, so feel free to share.
We'll talk about like one. Okay, I don't know.
Okay, thanks everybody. Our first thought exchange has come to an end. Did you want to speak to some of the thoughts, or are we going to move on?
Yeah.
A lot of consistent thought about one door, easy access, which, as Adrienne mentioned, that's not a surprise.
Yeah. And also the engagement, meaningful engagement. And I noticed the Indigenous communities there. And, I'm very, very honored to be wearing my paddles that represent the Coast Salish teachings that Tina mentioned this morning. She's wearing hers as well, that were gifted to PHSA by Knowledge Keeper Salkson in a kind of historic sharing of the teachings with the health organization, with PHSA. And so we're all very committed to walking that path of truth and reconciliation and figuring out what that means as we go. So really appreciate all of you bringing that up. And we're very committed to moving forward in a good way.
Trust.
And building that, rebuilding, re-earning that, earning that trust. Yeah.
Okay, and move on to the next one. Just a moment.
Wonderful. This is it's quiet but cool, right? Right? Yeah. Patient partners say yes, so I'll take it.
It's a time when it's appropriate to be on your phone.
All right, thanks everybody. So we're going to move on to the second thought exchange. So please take your phones out, scan the QR code. The folks at the back of the room are going to paste a link to the exchange in the Zoom chat for those of you online, or you can visit tejoin.com and enter the code 619-111-885. So, according to Doctors of BC's Provincial EMR Strategy Member Survey that was run in 2022, costs of EMR's administrative burdens and challenges associated with data portability continue to be significant concerns. So today we're asking you, what are the biggest and most impactful opportunities for AI to improve the healthcare provider experience in BC?
Awesome. And this builds on the panel that we had this morning. So if you didn't have an opportunity to share your thoughts with the panelists. Many of you did. That was a great, great dialogue, great discussion. If anyone missed that, it will be available on the Feedloop platform after the conference is completed. All the recordings will be posted. Big questions, right, Laura?
Yep.
So again, as you're entering the thought exchange, you will see a couple of survey questions, and then you can jump into the main exchange. You can enter more than one thought at a time, or sorry, you can enter more than one thought, but please enter one at a time. That would be great.
And I believe, Joanne, correct me if I'm wrong, there's AI involved in the theming of the insights. Is that correct?
Yes, the Thought Exchange group has revamped their AI behind the scenes, so it does help us a lot when we're analyzing the data. So yes, AI does play a part.
So I see increased time with patients, decrease. Those are some of the outcomes. What are some of the things that applications of AI, and it's okay, like whatever level of awareness you have, just share whatever comes to mind. But what do you think would be the most helpful? Is it in the taking and summarizing of notes, or the organizing of information? Or what else could it be? Yeah, I see generative AI for clinical documentation. There's one that's specific as you can be, but also really welcome all of your thoughts. Yeah.
So if you haven't started the starring process, feel free to jump in and do that. And again, these exchanges will be open for the next few days, so you can come back, share more thoughts, and star the thoughts of others.
So how do we improve? Yeah. Mm-hmm. Thank you.
So yeah, if you haven't joined the second thought exchange, you can go to tejoin.com and enter the code 619-111-885. So we've got about 2 minutes left. So if you have already rated some thoughts, feel free to jump back in and rate some more.
Great. I see some flagging, some support for prioritization. Good. And these will all be fed back to the respective strategy owners. All of your thoughts will be shared, summarized and shared with them. Translation. Yeah, wonderful.
A lot of it's really positive too, as opposed to being negative, like a negative connotation for AI. So it's good to see.
Mm-hmm. Yeah, we're used to kind of chatbots and AI in that consumer space, right? As modern the technology is becoming a part of our everyday lives. But there is, as mentioned in the panel, these bigger questions when we do apply it to our health information. So there's some big and small ways that this can make really meaningful improvements. And like Michael Tato was saying in the panel earlier, we're taking this very seriously as health organizations, and also making sure that we fully understand anything that is implemented. I like how he said we're not looking for magic solutions. We want to understand what's happening with the data and what's going on in the algorithms. So that is hopefully a sense of, building that sense of confidence in the new technology.
So we've got about 30 seconds to go. So feel free to jump back in and start some more thoughts.
Our early warning system. Yeah. Great. Cool. Interesting stuff. And this is going to continue to get more depth and breadth of information as you continue to rate and add thoughts and share. It is a virtual dialogue. We really encourage you to check it out beyond today.
Take some time over the weekend. Think about what you heard today and then bring it forward.
Great. I'm going to move on to number 3.
Great. Okay. Thanks, Joanne. So the next one, and thank you for the question in the audience. It is tricky switching between the exchanges. It's very true. I got lost just on Monday doing an exchange.
We could probably do an icebreaker next time, like have a fun question at the beginning. And yeah. Okay. Yeah. So this is our third thought exchange. So please point your phone's camera at the QR code. There will be a link pasted into the Zoom chat for those online, or you can visit tejoin.com and enter the code 291-739-898. So we're working to connect healthcare providers and patients across BC to support seamless information sharing and transitions in care at every stage of life. We recognize that a key component of a digitally connected health system is the reliability and accuracy of information shared between healthcare providers and patients. So our third question today is, what current pain points should we be prioritizing a solution for to create a more digitally connected health system?
Great. So this one really is about the ins and outs where data gets lost or mistranslated, forms, replacing faxes, all those kinds of things, and communication between and then things like scheduling or follow-up calls, the interactions between the patients and providers.
Having to repeat your health history to one provider to another provider at a different point of care.
Yeah, those pain points for patients and pain points for our friends who are delivering care. You may know some of these from your lived experience, or maybe they're stories that you've heard that people have shared with you over the years.
Or if you hear about it in the workplace.
So if you haven't joined the Thought Exchange yet, you can go to tejoin.com and enter the code 291-739-898. And you can enter more than one thought at a time. Or sorry, there I go again. You can enter more than one thought, but please enter one at a time. And once you're done entering your thoughts, please move on to the starring section where you can star the thoughts of others.
We're really making you work at this conference, aren't we? Thank you. Busy sharing your ideas. Thank you. Yeah, a lot about the history, and like Lara was mentioning, the repeating history, repeating summaries. Yeah, great. It's a big one. Yeah. And Mike kind of mentioned earlier, you know, it's my data. Why don't I have access to it?
Right.
It's you know, historically been very complicated processes to access your, I'm sure as many of our patient partners have tried to access your information. Yeah. Difficult process. It's possible, but paper-based for the main part.
So we've got about almost 2.5 minutes left. So if you haven't jumped into the starring process, please feel free to do so.
Mm-hmm. I know we have some clinicians and physicians in the room. I'm sure you've got stories where information gets lost or delayed.
Faxes.
Yeah. Yeah. So we'll be sharing this back with the Connected Health System team. They already have some priorities set out for this next year, but this will help inform of their path forward and how we move forward together towards the digital health strategy in general. This being I think a really exciting piece because it's been such a missing piece for so long. Really solving this ins and outs between the different levels and organizations of care. Maury is here from our Connected Health System team. She'll be reviewing your thoughts later on this one. Mm-hmm.
So we've got about a minute left. Feel free to jump back in and see if there are any thoughts that you haven't starred yet.
Just a note on our partnership representing ministry and PHSA up here. You know, I've been talking about our teams and but these are joint delivery teams with ministry and PHSA. So all of our teams are co-led and resourced and expertise from both organizations working together
in lockstep. Yeah. Collaborating since day one. Yeah.
on the provincial strategy. To truly make it provincial. Lara and I meet regularly.
Yep. Daily.
Yep.
Okay, thanks everybody.
Yeah, thanks, Joanne. Yeah, well, this is great. Thank you, everyone. Well, in the interest of time, we'll keep going. Yeah, thanks, Joanne.
One question to go. Oh no.
Oh no.
You can join back in through the links that'll be on the Feedloop platform. So if you wanna tighten that up a bit, you can jump back in later.
Oh no. Oh no. That's a pain point, isn't it?
Yeah, there you go.
Right in here in the room. Character limits.
So we're moving on to our last thought exchange of the day. So please take out your phone's camera and scan the QR code. For those of you online, a link to the thought exchange will be posted into the chat, or you can visit tejoin.com and enter the code 650-847-750. So the digital health strategy is aligned to the province's health human resources strategy to unify the most critical aspect of the health system, the people. So for our last question today, what do you see as some untapped digitally enabled opportunities to support the workforce of our health system?
Priority.
One way the Ministry of Health is trying to solve this problem is through its HHR strategy, which is an ongoing program.
The health human resource strategy.
Health human resources, yes.
Mm-hmm.
That's one strategy.
Yeah. So how
Looking
can
for more?
Yeah. So how, what's our sphere of influence as digital health experts and partners and collaborators to support that HHR strategy to help build capacity.
Build capacity, yeah.
Yeah, build capacity, better understand the capacity issues across the system. This is one I wasn't really aware of, so much, just how difficult it is to understand the provincial scope of the health human resource capacity issues, because we don't have that provincial view. So
And that's something that we're working towards, is trying to get that data so we can look at communities and where gaps exist, so we can try to fill those in with human resources, with people who can help in a community.
an example of how the digital health strategy is enabling other strategies.
Like primary care strategy.
The cancer strategy as well.
Sorry.
All the provincial priorities that Heidi mentioned this morning.
Right. Digital health has a foothold in all of those different areas of healthcare.
Yeah. We're really, hopefully everyone, will come to see us really as strategic partners in achieving their own strategic objectives. How can we, when that was the entire purpose of the engagement around this strategy, was to how do we align and enable all of the strategic priorities across the health sector.
Across the sector, yeah.
Including this one. Okay, what do we got? Here, shorter wait times. Okay.
So if you haven't jumped into the starring part of the exchange, feel free to do that and start starring some thoughts that are in there.
Exchange stuff. We can also think here of other specialties, allied health, our community partners, lab, medical imaging, pharmacy, not just our physicians and nurses, but across the whole health system. Yeah, that's the third one. There is kind of the crux of it. Break down silos for data sharing and collaboration between health authorities, ministry, and community providers. Yeah, it's if we're going to deliver care differently, I think we have to think about how we change other systems, like those critical enablers that Michael was sharing this morning. Critical enablers of the health strategy include a workforce, a workforce and the capacity, and information sharing as well. Yeah. Oh, access to mental health support. That's great. Yeah. Yeah. One of our applications is for the Foundry, providing support to youth mental health advice. There's also one, I believe, for ambulance workers that we created. ShiftWell, I think that's.
Well, yeah,
Yeah.
that's correct. Yep.
So something to learn from and grow that service.
So we've got about 30 seconds left. Time to get the last bit of starring done.
Wow. What great thinkers you are. Thank you for your participation, for your focus. It's time to put your phones away now. And shift back into the rest of our conference mode.
No, just thank you so much for participating and taking time to share your thoughts with us. This will help inform our strategy as we go forward. Take time over the weekend if you like, or later today, go back into the application and star some of the thoughts that have been raised here today.
And we look forward to learning from this experience, and Lara and I are really keen to host other thought exchanges and similar activities. So a big part of this is engaging across the sector, and lots of different ways we can do that. This is just one of them. So yeah, thanks for exploring this new tool with us today. Thanks, Joanne.
Thank you.
Thanks, Joanne.
Yeah, so there'll be an email with links. So yeah, you can check back in your email, but we can also chat afterwards if you would like more direction. I'm happy to help. Okay, thanks everyone.
Thank you all for that. I look forward to sort of seeing the summary of what came through and how we can take those thoughts that you guys all shared and move them forward in our approach and strategies around the strategy itself. And so we're going to shift into back into our panel sessions again and get back into some of those really rich, deep conversations. You've had sort of that post-lunch thinking, downtime for a moment, letting the food rest, etc. And so what I might suggest as we're just getting set up to reconnect to our online audience with the next session, there will be, as typical for our online audience, the Zoom poll that will go up. And we're just going to get set up here. But why don't we just take a 5-second even, if we just stand up, do a bit of a stretch, make some movement. So I will invite you all to stand up. Let's get some of that energy going. So this is what I also always think to myself when I'm doing this. Before you take a stretch, think to yourself, out of, on a scale of 1 to 10, where's my energy level right now? Probably could be 2, 3, maybe 5, 6. And then do that big stretch. Turn to your neighbors. And then ask yourself, okay, am I still at that same number? And if you are, I would recommend you do another stretch, but it's just a moment in time to reflect, recognize where you're at, and we'll just dive into the next session. So just give me 1 minute to organize and wait for the cue that we're ready to go, and we'll introduce our next presenters.